Respiratory failure occurs when the lungs fail to oxygenate the blood or remove carbon dioxide effectively. Today, we explore the two types, type 1, hypoxemic, and type 2, hypercapnic, their differences, causes, and management. Type 1 respiratory failure is defined by a PaO2 less than 60 millimeters of mercury with normal/low PaCO2, indicating inadequate oxygenation. Type 2 involves PaO2 less than 60 millimeters of mercury and PaCO2 greater than 50 millimeters of mercury, reflecting poor ventilation. ABG results are key. For type 1, oxygen drops alone. In type 2, both oxygen and CO2 levels are affected. Type 1 arises from impaired gas exchange. Think pneumonia, pulmonary edema, or blood clots. Type 2 stems from alveolar hypoventilation, as seen in COPD, neuromuscular diseases, or drug overdoses. Severe asthma can start as type 1 but may escalate to type 2 if respiratory muscles fatigue. Type 1 management: high-flow oxygen, CPAP, or mechanical ventilation. Treat the root cause, antibiotics for infection or diuretics for edema. Type 2 management: controlled oxygen to avoid suppressing the hypoxic drive. BiPAP assists ventilation, while medications like bronchodilators address underlying issues. Aspect differences include type 1 with normal/low PaCO2 focusing on oxygenation, and type 2 with elevated PaCO2 due to ventilation issues. Example causes are pneumonia for type 1 and COPD for type 2. High-flow oxygen is typical for type 1, whereas type 2 requires controlled oxygen and BiPAP. Timely diagnosis and tailored management are crucial. ABGs guide therapy, and vigilance prevents complications. Whether it's type 1 or 2, understanding the physiology saves lives. Always consult clinical guidelines and individualize patient care. Key takeaways: type 1 is oxygenation failure. Treat with high-flow O2 and address underlying cause. Type 2 is ventilation failure. Use BiPAP and controlled oxygen. ABGs are diagnostic cornerstones.